Welcome, everyone. Today, we will go over Section 6 of the Child Care and Development Fund Plan, which all tribes who have medium and large allocations will fill out. This session covers equal access to quality childcare, which we will walk through together. So let's go to the welcome slide. I'd like to have each of our presenters provide a brief introduction. Let's begin with Kathy.
Hi, everyone. I'm Kathy Hopen for the Tribal Childcare Capacity Building Center, TCBC, and I provide technical assistance to tribal lead agencies. Melody?
Hello, everyone. This is Melody Redbird Post, Project Director of the Tribal Childcare Capacity Building Center. Great to see you. I'll pass it over to Selena.
Thank you, Melody. And my name is Selena Curley. I am the subject matter expert on subsidy administration and equal access with the Tribal Child Care Capacity Building Center, TCBC. Before we really dive into our presentation, we will be using common acronyms throughout this presentation today, such as TCBC for Tribal Child Care Capacity Building Center, CCDF for Child Care and Development Fund, and OCC for Office of Child Care. So the next slide, we will cover the objectives. So this session is all about creating access for the families served in your CCDF program to high quality childcare options in your CCDF service area. In this session, we will be reviewing Section 6 of your plan. We will not be covering Section 3 of your plan, where you dive deeper into what quality childcare services are. So we won't be covering that component today. There are several methods and considerations tribal agencies need to make in order to meet the equal access requirements. We will walk through each of the requirements, all in hopes that you walk away with an understanding of the minimum requirements and flexibilities for providing equal access to quality childcare. They include direct childcare services and funding methods, establishing adequate payment rates for childcare providers, improving access to childcare for vulnerable children and families, optional family contribution to childcare payments, including the new co-payment limit, understand what sufficient responses are for Section 6, and to provide opportunities to build awareness of implementation of Child Care and Development Fund, or CCDF requirements. Let's begin with definition of direct services in our next slide. So you might be wondering what we mean when we refer to direct services. Direct child care services are the act of providing child care to a CCDF eligible child by a CCDF eligible child care provider for the purpose of CCDF. An example of this would be a caregiver caring for an infant or a preschool teacher providing care for a group of 3 to 4-year-olds. Direct services can also be referred to as the act of paying for childcare services to a childcare provider in the form of a subsidy payment. Next, we will review the ways a CCDF program can fund childcare services. In the submission guide, at section 6.1.1, it says, tribes have options for how they can pay for direct childcare services. We refer to these options as funding methods. A tribal agency can choose from the following ways to pay for childcare. 1. Certificates. A certificate or voucher is issued by the tribal agency for parents to use to pay for childcare at an eligible childcare provider. Tribal agencies may pay the certificate directly to an eligible provider on behalf of the parent. Families may obtain a certificate that they can use to purchase the childcare of their choice. This mechanism is required to be used by tribal lead agencies with large allocation sizes and is optional for tribal lead agencies with small and medium allocation sizes. The second one is grants or contracts. Tribal lead agencies may provide services through grants and contracts with eligible providers to directly serve CCDF eligible families. This means the agency pays a provider for a childcare slot, and the slot is held until it is filled by a child enrolled in the CCDF program. Grants and contracts can be used to build a supply of available childcare slots, and they provide stable funding to providers. Grants and contracts for childcare slots normally include a written contract or agreement between the tribe and the eligible provider. It outlines a scope of services and responsibilities. Tribal lead agencies that use CCDF funds for contracts or grants may have slots that go unfilled at times, and that is okay. This is an allowable expenditure, even if there are periods of time that contracted slot is vacant. The third one is the CCDF funded tribally operated center, or TOC. Tribally agencies can choose to use their CCDF funds to cover all of the operational costs of their own childcare center. This is considered a CCDF funded tribally operated center. Regardless of the way you choose to pay for direct services, tribal lead agencies are responsible for ensuring that all providers of direct services meet the provider eligibility requirements, follow applicable health and safety standards, and adhere to the tribal lead agency's policies and procedures. Next, we are going to talk about funding methods for consortia tribal lead agencies. Are there any consortium lead agencies with us today? If so, this is good, solid information to share. In section 6.1.2 in the plan is a question only for tribal consortia, where consortia will describe how they fund the direct services for each of its participating member tribes. The description must include any of the variation used in funding methods, such as certificate and vouchers, grants and contracts, and tribally operated centers. And the category of cares are center-based child care, family child care, and in-home child care. So this is good information for CCDF for each of the participating member tribes or villages regarding the consortium. The response must also describe the direct services for each of the participating tribe. A description of coordination in the development of plan was already included in plan section 1.4.3, so that is not needed here. This question is narrowly about how member tribes receive or provide direct services to the eligible children and families in their service area. Direct services can vary widely across the consortia service area and are from member tribes to member tribe. For example, a consortium may have a tribally operated center in one tribe's community and offer certificate only in another tribe's community. Tribal lead agencies have broad flexibility in how they coordinate CCDF services with participating member tribes and or villages, but there must be some type of coordination of services. The Office of Child Care released new guidance for CCDF Consortia Lead Agency, and it is included in our resource directory. Next, we will look at sample response for 6.1.2. Consortia lead agencies should take steps to ensure that funding is distributed to each member tribe in a manner that provides equitable distribution of childcare services across all member tribes. This sample response says, our CCDF Tribal Consortium Lead Agency offers all eligible families in our combined service area the choice of vouchers and certificates for center-based care, family child care, in-home care, and relative in-home care. In addition, Tribe A receives CCDF funds to operate a child care facility, and Tribe B receives CCDF funds to operate a child care facility. Our lead agency also has contracted slots at child care centers for children in or in need of protective services. Reminder, this is only a sample response of a brief description. Your tribal consortium lead agency should have more detailed policies and procedures that cover both the direct services arrangements and the funding arrangements with all member tribes. Alaska Native regional nonprofits are encouraged to coordinate with individual tribes who do not integrate CCDF discretionary funds, but where the consortium lead agency receives the CCDF mandatory funds on behalf of the tribe regarding the use of CCDF mandatory funding within their community. Again, please use the new guidance from the OCC on consortia CCDF implementation. And now I'd like to give the time over to Kathy.
Thank you, Selena. So question 6.1.3 is building the supply of childcare. Tribal aid agencies must develop and implement strategies to increase the supply and improve the quality of childcare for children, including for children in need of non-traditional hours of care, infants and toddlers, children with disabilities, and children in underserved geographic areas. In this question, the Tribal Lead Agency will briefly describe strategies to increase the supply and improve the quality of childcare services for each of these populations of children. As a reminder, building supply can include both CCDF-funded services and community-wide childcare services not affiliated with your CCDF program. Now, please note, an effort on strategy for each of the 4 populations listed here and in the plan are required. It's at the Tribal Lead Agency's discretion to serve other underserved populations as defined by the tribe, in which they would like to build a supply of childcare. If the Tribal Lead Agency implements strategies for additional underserved populations of children not listed in the plan, it will select the optional other and provide a description. Now, next, we will review some optional strategies to meet the CCDF requirement for the Tribal Lead Agencies with medium allocations. Now, offering a certificate program can be considered increasing the supply of childcare, as they are exempt from offering a certificate program. Now, community-wide strategies could be included in your supply and quality building efforts, like engaging and partnering with employers, family childcare networks, provider membership organizations, and community-based organizations to build a supply of care. Again, the requirement is to strategize and make the effort to 1, build a supply, and 2, increase the quality. Now, in 6.2, so for the CCDF programs that offer voucher or certificates, the payment rates paid to providers for CCDF services are very important and greatly impact the community's ability to access high-quality childcare options in the service area. The base payment rates must be set at a level that families participating in CCDF have equal access to comparable childcare services. In other words, the rates must be high enough that most childcare providers accept the subsidy or payment rate, giving CCDF families access to a similar range and number of providers as those not receiving CCDF. Now, in 6.2.1, Tribal Aid agencies will certify that the base payment rates are sufficient to ensure equal access. Tribal Aid agencies who cannot certify that their payment rates are sufficient must provide a brief description of why their rates are not sufficient. Now, on the next slide, 6.2.2, you will describe your process for setting rates that consider the cost providers incur in order to provide healthy, safe, quality environments, and that consider staffing costs, and that enable the provider to meet the needs unique to your nation and community, such as cultural and language needs. The Tribal Aid Agency has flexibility in possible strategies to support certifications, which include reviewing feedback from your families, including family parent surveys or family parent complaints even. Reviewing feedback from providers, including provider surveys or provider complaints about low payment rates. Now, setting payment rates at the 75th percentile or higher of the most recent state market rate survey or other child care rate data. Now, using tiered rates, differential rates to increase access for underserved or vulnerable populations, or using a state market rate survey. So let's review the sample response. Our tribal lead agency requested and reviewed rates from all provider types we serve in our CCDF service community. We also requested information on the cost to meet the CCDF health and safety and quality requirements, including staffing needs. We then set our base payment rates at a level to cover the components, including the needs of our tribal community. Now you can see that this response covers all 4 components listed on the slide and in the plan. We've covered health and safety, quality, staffing requirements, meeting the needs of the tribal community. Now let's take a look at another sample response to see if it covers all the criteria. Now on this slide, let's look at another sample response. In this sample, the tribal lead agency reviewed the state's Office of Child Care approved market rate survey data and subsequent, hopefully decided to pay a certain percentage higher than the state's rates. Just a reminder, tribes are not required to use the state's market rate survey or conduct their own when determining their own provider rates. And just a note about using the state rates, we encourage you to check with your state partners if you decide to use their payment rates. Some state rates may not be compliant with equal access requirements, meaning that their rates are considered low and or not meeting the CCDF requirements. Now, states can also choose to change or increase rates over time. And if your intention is to meet or exceed their rates, you may want to know that information before it becomes effective so that your program can take action if you choose. Another reminder is to choose a state payment rate and or market rate survey in any way, and the state was determined to be non-compliant with the equal access requirements, your agency will not automatically be considered non-compliant. It is a tribal lead agency's responsible to demonstrate they are meeting the requirements through their selections and responses in the plan. Now, hopefully these slides are helpful to you as you begin to complete your plan. Now 6.2.3. Now this is an excerpt from the CCDF plan. For each category of care you provide, you will enter the full-time, weekly base payment rates next to each age group as a dollar amount. For example, if you have different payment rates in different parts of your service area, enter the highest payment rate for each age group paid by your tribal lead agency. Now, many of you may have your rates as monthly, daily, or even part-day rates and will have to calculate the weekly rate. If you need assistance in calculating your rates, please reach out to your regional program specialist. And remember, while tribal lead agencies have the flexibility to establish tiered, differential, and or add-on rates in this section only, base payment rates are reported. Another reminder is CARS will only open the sections for the categories of care listed in section 1.8. If the categories of care in section 1.8 are not correct, return to section 1.8, update, save, and then come back to the plan question 6.2.3 to enter the information. Use the defined ages identified in section 2.5.1 for infants, toddlers, preschool, and school-aged children. Now, this wraps up my portion of the payment rates. And now I'd like to give it over to Melody, who will complete our presentation.
Thank you so much, Kathy. So now let's look at 6.2.4. Tribes have the flexibility to limit the use of in-home childcare, which is where the provider provides care in the child's home, but are not required to. If your tribal lead agency offers in-home care, here are some considerations. First, setting a minimum age of provider. For example, a provider must be at least 18 years of age. Having a maximum number of children allowed in care due to the Fair Labor Standards Act or minimum wage. Requirements about the hours of care provided, such as a certain number of hours or only allowed for non-traditional work hours, etc. Only allowing care by relatives as defined by the CCDF regulations. and only allow care for children with special needs or medical conditions. So this is a good opportunity to think about some questions to ask yourself and your team, thinking about your program. Do you currently limit in-home care in your current plan? And think about if you'd like to put any limits on in-home care for this upcoming plan. All right. So tribal lead agencies are required to give priority for childcare assistance to children with special needs and children experiencing homelessness. The prioritization is not limited to the eligibility determination. The first step in improving access is to define children with special needs in 6.3.1. Tribal lead agencies have flexibility in determining which children are considered special needs. There is no federal definition of children with special needs. The definition of children experiencing homelessness, however, is defined by the McKinney-Vento Act, which we will take a closer look at next. Tribal lead agencies are required to use the McKinney-Vento Act definition of homelessness and should review its policies and procedures for services for children experiencing homelessness to ensure this definition is included there. Tribal lead agencies can improve access to child care for children and families experiencing homelessness through a variety of methods, such as including them within the definition of children with special needs, including them within the definition of protective services, prioritizing them for enrollment in childcare services, serving them without placing them on a waiting list, paying a higher rate for access to higher quality care, using grants or contracts to reserve spots, or waiving copayments if implementing copayments for families. 6.3.2. Tribal lead agencies are required to use CCDF program funds to 1. Permit the enrollment after an initial eligibility determination of children experiencing homelessness while required documentation is obtained, allowing a grace period. 2. Provide training and technical assistance to child care providers and the appropriate tribal lead agency or designated entity staff in identifying and serving children experiencing homelessness. 3. Conduct specific outreach to families experiencing homelessness. In 6.3.2 of the plan, you will certify that you are doing all 3 required items here. In March of 2024, the rules and parameters for family copayments substantially changed. All tribes can exempt all families from copayments or family contributions to care across the board. This does not mean, however, that tribes are prohibited from requiring a copayment from families participating in CCDF if they choose. This is a big change to CCDF requirements. Tribes have broad discretion in setting the criteria for copayments with this new flexibility. For instance, copayments no longer have to be based on family size or income, or what we refer to as a sliding fee scale. Can be a flat rate for all, can be waived for families based on tribally defined criteria, such as, but not limited to, parents engaged in certain types of work like subsistence activities, parents enrolled in Indigenous language education programs, or parents living on your tribal lands. Again, these are just samples of the flexibilities now allowed under this requirement change. We encourage you to also consider copayment changes along with any potential income eligibility changes, as income is no longer an eligibility requirement for tribes of all allocation sizes. Section 5, Parts 1 and 2 offer a deeper dive on income eligibility flexibilities, and we encourage you to keep the copayment topic on your mind as you navigate and review that section of your plan. You will see in 6.4.1 in the plan that there are pre-populated optional criteria to waive family copayments to choose from, if you choose to assess one in the first place. You will also see an other option, which is where you would describe the additional criteria if applicable. The other new requirement is that if the tribal lead agency decides to assess a copayment, it cannot exceed 7% of the family's income, regardless of the number of children in care who may be receiving CCDF assistance. You will tell OCC what the highest copayment families are charged as a percentage of income, if applicable. Next, we're going to talk about if your program does choose to still assess a copayment and the copayment is over 7% of a family's income for any family size, how you could apply for a waiver from the cap requirement. Again, the new requirement states that if tribal lead agencies choose to require families to pay a copayment, they must cap the family's total copayment at 7% of family income. Because some tribal lead agencies may need additional time to update their copayment structure to comply with the new 7% cap, those that currently charge copayments of more than 7% may request a transitional waiver. Transitional waiver requests must be submitted by August 1st, 2025. The waiver request may be backdated to April 30th of 2024, the effective date of the 2024 final rule. Approved transitional waivers may be valid through August 1st, 2026, after which all tribal lead agencies with a medium or large allocation are expected to be in compliance with the updated requirement. Office of Child Care will review tribal lead agencies for compliance with the 7% copayment cap during the submission of the fiscal year 2026 to 2028 tribal CCDF plan. Please contact the Office of Child Care for more information about how to submit a waiver request or to discuss whether you may need a waiver. As you reflect on the content shared, some questions may have emerged for your next steps, such as, what additional information do you need to complete Section 6 of the plan concerning direct services and funding methods, payment rates, improving access for vulnerable children and families, copayment options? What partners might you need to connect with about this section? What questions or topics would be helpful to discuss with Office of Child Care? And finally, we'd like to share how to connect with us. If you are not already, please do subscribe to the Office of Child Care announcements to receive all of the latest information. And feel free to email occtribal@acf.hhs.gov if you would like to connect directly. Thank you so much for your time.